Yo, yo, everybody, what's up? Been a while. I haven't been on a live in like 2 months type thing. Um, so, listen, okay, why I referred a patient out to for an emergency the other day. So, I have a chronic pain. Most people come in here and said I've failed everything. They've had their pain over, at least a year and a half, um, and most of them decades type thing. And anyways, I so physical therapists or primary care, in a lot of states in terms of we can see people off the street type thing, no physician's referral. So consequently, you have to be able to understand how to screen out potential medical emergencies, right? So what I had the other day was a guy come in, and yeah, so I was just on vacation, and he had a slip and fall. He's like, I've had chronic back pain for 15 years. He's like, I had a slip and fall, and my back's killing me, and I wanted to, kind of put this to rest once and for all because, I'm generally okay. And then boom, my back goes out, that kind of thing. Right. So to me, off the cuff, it sounds like, okay, this guy just, he just irritated, his back spasm, which I find to be acute SI, sacral torsion shear. If you check these people using my diagnostic procedures, the ones I published, I think you'll find the same. And so I start asking him, after he's finished with his story, I start asking him questions, right? Now, if there's trauma involved and the person's in a lot of pain, they should get an x-ray type thing, right? But generally in here, most of my patients have had x-rays, MRIs, you name it, they've seen it, like everybody type stories, they say, right? So they've had x-rays, they've had MRIs, but this was an acute incident, okay? He could walk in here, right? It wasn't like he was like he had an obvious fracture in his back where they're just like, the person can't stand up, right? He's like, it's been getting better, but I just want this to go away, right? So I asked him, okay, so he had recent trauma, so that's a question mark in my mind, right? And then I ask him, the three things you need to ask him is saddle anesthesia, right? He had no radiculopathy. Okay. And then I asked him, have you seen an MD about this? No. I'm the first person that he has seen about it type thing. And since it happened. And then I asked him, I check for weakness, no weakness. And I say, have you ever had any bowel or bladder issues since this happened? Okay. Now, what you usually hear is stories about constipation or urge incontinence and stuff like that. But, they're just general benign stories about, people having bathroom issues, right? But in this person's case, he said, yeah, actually, when this happened, he was in his 40s. It only happened once. He said, and I turned and I defecated on myself. And he was like, I was shocked that happened. I didn't really know what to make of it. So that was that, right? And I told him, listen, I stopped the eval and I said, listen, I said, you need to, I said, you don't have any weakness, right? You don't have any of that going on type thing. Has it only happened once and that was a week and a half ago? Yeah. Because if it was happening like all the time, I would send him to the emergency room. But since it's only happening once, and that was a week and a half ago, I said, I want you to make an appointment ASAP now with this spine surgeon up the road. I said, that's considered a red flag and it needs to be checked, okay? I said that because most of these people, like I said, most of these people have had MRIs, okay? Scanned up the wazoo, no recent trauma, it's just this chronic thing they deal with, right? With low back pain. But what I was concerned about, obviously, is Cauda equina syndrome. And I was concerned that this patient was, has a disc pushing deep into his spine. Okay, this has never happened before, and that is not a normal thing to happen. Okay, so I sent this patient. Okay, so with the instructions to go see a spine surgeon ASAP, I said, if you can't get in, go to the emergency room. I said, if this happens again, or you get weakness in your legs or numbness and tingling, where you would sit on the saddle of a horse, you need to go to the ER, like that moment, drive to the ER type thing. And, I would say 6 times in my career, if I could count, 6 times in my career, I have seen Cuddy-Equina syndrome, which is, I believe that's what was going on there, Cuddy-Equina syndrome. And one time they had seen the appropriate provider and never asked the question, but I did. And I sent them back type thing. Now, in your clinics, most people that follow me are either cash-based clinic owners, which you need to screen for this. Everybody should. But in your clinics, most of these people come from MDs. So if you work at like a traditional clinic, they're coming from an MD, right? So hopefully that question was asked. But I've had people over the years say, hey man, like I thought there was something off with my patient. They had been referred by an MD, and I sent the patient back to the MD, and then I got reamed out and written up, and I'm like, well, the reason why you got written up is because you're threatening a referral source for the clinic from a business standpoint. But what I would do in that case, in my case, I can do whatever I want in terms of get the person immediately to go see somebody, right? But in that case, if you're like work for a clinic type thing, what I would do is I would call the doctor or the nurse and say, I have this patient that was referred over here. He's incontinent, or like a bowel or bladder. He's reporting with a back injury. Would you like me to send, and just say that obviously is a potential red flag. The person is not sure he told you about it or whatever the story was. And what I would say is, would you like me to have the person come back and see you? And just leave it at that, okay? And the reason why I say that is because I know that you can irritate MDs because in the hierarchy of medicine and orthopedics, that they are above us, in terms of although our diagnostic skills statistically is like 78 to 82%, which I still think can be improved on drastically. But you can irritate a referral source type thing. But you got a patient's well-being, and it's your job, and it's your license. Actually, it's your actual license. So I would refer them back, or call the doctor and say, I need to speak with you, et cetera, et cetera. Okay. So these can be, obviously, you can be paralyzed from this, not good, So you should definitely take action if you were to hear this, but always screen the patient. Recent trauma, no MRI, no recent MRI with it, or X-ray, and then saddle anesthesia, numbness and tingling when you sit on a saddle of a horse. By the way, that could be SI. You open up their SI, hold it there, and I see it a lot. And I documented in my root cause of SI joint dysfunction paper that the person can have genital numbness or symptoms, tightness, something. They go to pelvic floor therapist, whatever, and it was actually SI joint. Why? Because I hold it open, and then they say, no, it's gone. And I'm like, no, that's SI, So anyways, and then obviously bowel and bladder dysfunction, and not just I'm a little constipated sometimes, or I need to go find a toilet, every once in a while, that kind of thing. We're talking about incontinence, or not being able to go at all, period, since the back injury type thing. So anyways, that's obviously very important. We all learned it in school, and we all should take action when that happens. So that's probably my 6th one that I've seen in my career, if I'm counting correctly. Anyways, that's that. If you want to join my clinical mentorship where I work with you, I do live videos. You get all my courses at a 59% discount. You can join that. But then what I also have is my cash-based clinic, which I'm talking more and more about. Join my school group below, okay? I linked it below, or go to wheltonmethods.com and join my free VIP group. And I'm going much deeper into this kind of stuff, okay? And then I also have my hybrid cash-based clinical mentorship, which is a 7-figure model working 20 hours a week. And I show you how I'm doing. So if you just join my school group, you'll see posts about it, the analytics and numbers, how I'm doing. This is for clinicians only. This is not for chronic pain patients. I love you, but this is the place for us to talk. Join that, and I'm teaching you how I created this extraordinarily powerful clinic where we target certain conditions, and I show you how to market. I give you my marketing company that I use, and we do this together, and I work with you one-on-one. All you need to do is have the willingness to change your ways clinically and business-wise, and I will teach you the rest on how we do this, okay? And I predict that you will not ever say that this is the most highest job satisfaction you've ever had, because these people are coming in with chronic pain. It's not as hard as you think. It's usually SI joint or sacrotorsion shear together, stress issues in their neck, or actually rib head misalignments. I see a lot, that kind of thing. And these people have tried everything. They can't stand up, they can't sleep, can't roll over in bed, that kind of thing. It's horrible. It's horrible. It's heartbreaking. They cry all the time. But what I do is I bring them in. There's no sales techniques. I'm not a natural salesperson. You try to be a salesperson, and you're not a natural salesperson. Patients sense that, and they're just like, give me the door, right? I'm not a natural salesperson. I tell people the truth. And they can tell I'm telling them the truth. This is a lot of work, you know. If you don't do it, then there's no point to seeing me. You know, could take 8 weeks, could take months, you know, like you have to be willing to put in the work, you know, type thing. And patients aren't actually used to they're used to like trying to get people to sign up for their program type thing, but not me. You know, people sense that I'm authentic. I'm just telling you the truth. I'm not a natural salesperson. There's no sales techniques involved in what I do. I use my clinical skills to demonstrate I know what I'm doing, and I understand their problem. And then the patient trusts me because I actually just showed them what the problem was. And, you know, it doesn't show up on x-rays and MRIs type thing. And that's why you fell through the cracks. Okay. So that's that. Anyways, join my school group below. Okay. Whelton Methods. And you can learn more about my clinical mentorship. And then also my 7-figure, 20 hours a week, working hybrid cash-based clinical mentorship. Okay. Other than that, I love you all. Everybody have a good day. Peace.